Next one's going to be a very interesting clinical application of AI in carotid disease. It's some initial work. This will be presented by Dr. Jackson.
Go ahead.
Hello, my name is Dr. Tatum Jackson, and I'm going to present to you this morning our plans for utilizing artificial intelligence to detect plaque morphology from carotid ultrasound scans. It is our hope that through the algorithms of AI, we will be able to characterize high and low risk carotid artery plaques undergoing interventional treatment. I currently sit as a member of Ayatella's advisory board. Vascular surgeons' interests in carotid plaque morphology began 36 years ago in the 1980s, largely due to the work by doctors Lusby and Wheelgray. To date, there are certain elements of carotid artery plaques which are known to be at risk of developing a stroke in patients over time. This evidence comes predominantly from the study of over 1,000 patients in the asymptomatic carotid stenosis and risk of stroke study group. It has been demonstrated by Professor Nicolaides and the ACSRS study that the important plaque characteristics which classify a plaque as high or low risk include the amount of plaque, the echolucency of the plaque as measured by the grayscale median, and the presence of small discrete white areas within the plaque as demonstrated here by their significant p-values. In addition, it is important to highlight plaques lacking a thin fibrous cap, referred to as juxtaluminal black areas, are at a significantly high risk of causing a cerebrovascular accident. I think there's one more image to come up there. Thank you. At the present time, due to operator dependence and time-consuming limitations, very few people are assessing carotid plaque morphology in the treatment of patients. I would like to introduce Jack Parker, who we are working with alongside Professor Nicolaides, to explain to you how his company, Ayatella, is using AI to detect high and low risk carotid plaques undergoing angioplasty and stenting in just a matter of seconds.
Thank you, Dr. Jackson, and to the organizers for the opportunity to speak to you all today. Indeed, the practical application of AI in medical imaging can be summarized by the fact that an algorithm considers an image as a series of pixels in 2D or as voxels in 3D, with defined values such as color, intensity, and density. And it does this simultaneously rather than sequentially as we humans think. Therefore, speed, accuracy, and detection of minor changes are the major benefits of this technology. The Ayatella AI was developed by our team in Helsinki, Finland, and has been initially validated in a study with NHS colleagues to detect and measure the aortic valve and root, as we're seeing on screen, for stenosis and dilation, respectively, in anticipation of TAVI procedures. Now, in collaboration with Professor Andrew Nicolaides and the Arizona Heart Foundation, we have identified the features of carotid plaques that can be assessed by AI. And here we're seeing some initial outputs of the AI after being trained to detect the lumen plaque and the IMT dimensions in these DCA. Here we see the AI's detection of the carotid lumen and plaque in a cross-sectional video study. And as I mentioned, because the AI considers an image pixel by pixel, we now aim to apply the characterization of plaque based upon the criteria identified by Nicolaides et al. The desired output being a classification of plaques as high or low risk to inform the interventional approach. And because this is fully automated by AI, results are currently achieved in approximately 10 seconds. And an additional feature of the AI is the 3D reconstruction of the vessel and any detected plaque, which, when characterized by the AI, can be heat mapped for rapid triaging, as we're seeing here. Thank you.
Thank you, Jack. Once we have validated our technique with Professor Nicolaides' group, our next step is to apply this technology so that it is instantaneously available to assess carotid plaques in patients undergoing angioplasty and stenting in order to determine their risk of stroke. This is being done in collaboration, as Jack mentioned, with the Arizona Heart Foundation and Professor Ivo Petrov at the City Clinic Cardiovascular Center in Sofia, Bulgaria, pictured here. This is a continuance of the collaboration established by Dr. Ted Dietrich, my grandfather, to further advance the safety and practice of endovascular procedures. Thank you.